All right, good afternoon. We are here with Dr. Joe Gay and Kay Robinson from Jackson Hospital. Dr. Clemens, the president of Chipola College, asked us to convene this panel to discuss COVID vaccinations. This is obviously a pandemic across the country, across the world, and it is affecting Marianna, Florida, and Jackson County. And so Dr. Gay asked if we could get together and talk about the urgency of vaccinations and just kind of what's going on in this community.
This is the fourth surge of COVID-19. This is a particularly bad one. There are probably 1,000 counties in the United States that are heavily infected. About 85% of the infections are the new Delta variant, which is more highly contagious, maybe more virulent. In Florida, Northwest Florida is a hot zone, and Jackson County in particular, but all the surrounding counties are seeing rises in COVID COVID infections. This summer feels a lot like last summer. The differences are significant, though. Last summer, we had limited testing, we had unproven therapies, and we had no vaccines. This summer we have widespread testing available. We have very good inpatient and outpatient therapies. Our medical staffs at the hospital and our primary care doctors around the county are better at managing this infection. And we have vaccines for those that are eligible. The problem we're having is we don't have enough people vaccinated. About 3 weeks ago, the University of Florida contacted some community leaders about the urgency of vaccinations in Jackson County and the Panhandle and what they were seeing through their information through their university system. And they asked some of us to develop a community coalition aimed at vaccine hesitancy, part of their vaccine initiative. And so we have been spreading the word and trying to get information out to the community about the urgent need to get vaccinated in lots of different ways, through social media, through the print, through forums like this, and through webcasts to different entities. We had planned to do in-person group meetings with civic clubs and businesses, but because of the surge, we've been unable to get out into the communities, and that has limited us significantly, and maybe a reason why the vaccination rates have not increased more than they have. So 40% of those over age 12 in the county are vaccinated. We've done a better job in those people over age 65. I think it's 65% are vaccinated. Sir. So the elderly often have more risks, and they've become vaccine believers. And so that population has moved quite far in getting vaccinations. But the age over 12 in the county is only 40%. That leaves 60% of our population unvaccinated. We think that probably 30% of that can be nudged and towards vaccination, and that's what this effort's all about. There are many, probably another 30% that we're having trouble getting to, and they're pretty dug in for lots of different reasons. One of our approaches, and this comes out of the communication department at the University of Florida, has been an approach that is less confrontational, that we provide information, we ask a lot of questions, we want to know what people's beliefs are, why they're hesitant, and address some of those concerns. At the same time, we want to get information out that counter a lot of myths that are on social media. And the question is, what's causing vaccine hesitancy? And so it seems to be fear. It's fear of the government, it's fear of science, and it's fear of some of the myths that have been spreading. think Ronald Reagan said that the 9 words that most U.S. citizens fear is, "I'm from the government and I'm here to help." And a lot of folks in this part of the country heartily believe in that. And there's a good reason to have a healthy distrust of the government. It's good for democracy. But I can't really address that issue. What's important to me is the science, and I think the science can be trusted. It's the same science I've trusted to take care of patients for over 40 years, 30 of those years in this community. So when I recommend to a patient early in my career in 1990 here who had diabetes and high blood pressure and high cholesterol and heart disease and was overweight, that they should take certain medications, should have certain dietary and lifestyle modifications. If those patients listened to me and my recommendations were based on my understanding of the science and training, then those patients are now entering retirement, and they're doing so healthy, and they're going to enjoy their retirement years because of that advice, that science. Those that didn't listen to me may not be here, but if they are, they're not quite as healthy, and they are facing retirement in a less healthy condition. And so I trust the science. My patients have trusted the science, and the vaccinations are about the same science. I mean, think of the miracle cures and the medications and the cancer therapies and the therapies for cardiovascular disease and all the progress we've made and all the medications that many people who are hesitant take every day. I mean, look in your medicine cabinet. There's plenty of evidence there. And so I believe in the science. I believe that the vaccines that are available are good science, and recommend them heartily. There are some myths out there that really have very little basis in fact. It's very difficult to understand where these myths come from. So when you try to search the data and try to determine where a myth starts, it's very difficult to get at the root of it. So a myth like the COVID vaccine gives you COVID. I'm not sure where that came from, but that's not true. The government can track me through a vaccine. I'm not sure how that would be possible. The vaccine can change your DNA. That's not true. The vaccine can make you sterile. That's not true. The vaccine can cause AIDS. No. And in fact, if you have HIV, you're at a much higher risk for serious complications from the virus, and you should be vaccinated. The vaccines cannot be given to people with allergies to eggs. That's not true. Vaccines were rushed into production. It's true the vaccines were advanced quickly, and the reason for that was our experience and understanding of the human genome that's about 20 years old. We're able to map genomes of many different species, even historical species that we have discovered. And so we were able to map the genome of this virus within a month of its discovery. That gave us a huge leg up, along with the advances in vaccine research already in place. So major centers, major pharmaceutical agents, pharmaceutical industry personnel were able to get a virus to market quickly. And so it was quickly developed, but not rushed. And there were safety concerns that were addressed. The vaccines are not fully approved by the FDA. We expect that to happen within a month. But if you look at the number of vaccines that have been given in the United States, over 190 million vaccines given. In Florida, 6 to 7 million vaccines. In the world, many, many more millions of vaccines. That's far greater than the number of vaccines that the FDA requires for safety for any drug or vaccine. So those are some of the myths out there, and I'm not sure how they get started, but I hope that goes in some direction in correcting some of those myths. I would like to talk a little bit about the effect of the surge on our healthcare community. The hospital here has had 18 months of exposure to COVID. Kay is going to talk about some of that. Our nurses have been overwhelmed with multiple surges, and this is probably the worst. We're better prepared for it, but the numbers are still rivaling those of last summer. And when you add that to a group of people that have given so much and still see very little participation in a majority of the county's population, is disheartening. And so the first responders see that, the nurses at the hospitals, the nurses in the private sector, nurses with hospice, nurses and personnel at the health department, all of those people have done a tremendous job. Many people have died from the virus.
Right.
We honor those folks by participating in our vaccination programs that are highly recommended.
Okay, I'm an RN, but I'm also the Director of Infection Prevention, Employee Health, and Emergency Management at Jackson Hospital. And just a statistic of note is from the very beginning, the very first COVID patient that we had hospitalized, Jackson Hospital has only had 6 hours during this whole time that we have not had a COVID positive patient in-house. The numbers are staggering. The staff are tired. They are worn out, they are frazzled, but they continue. They give great care to these patients. They are the patient's family, they are their caregiver, they are their spiritual advisor, they are oftentimes the last face they see before they go on the ventilator. And so it is taxing physically, it is taxing emotionally, it is taxing spiritually to these healthcare providers. From the physicians to the CNAs to the environmental services to the dietary staff, it is taxing. As far as numbers at our hospital, this morning our census was 64 patients in-house, which is a large amount for our hospital. And of those 64, 37 were COVID positive. Of those 37, 35 were unvaccinated. There are 9 patients on the ventilator that are COVID positive. 8 of those are unvaccinated. So we have seen the difference in vaccinated versus unvaccinated. It is not propaganda. It is not commercialization. It is not bureaucratic nonsense. We see it every day. The numbers tell you that unvaccinated people are hospitalized way and above vaccinated patients. Even the vaccinated patients that we do get do so much better. They're in the hospital for 3, 4, 5 days, they get their treatment, they go home, and they do well. In the hospital today, our COVID positive patients range from the age of 31 to 80. We have one as young as 33 today on the ventilator. And it's just heartbreaking because I know personally patients who have passed away before the vaccine was available. And I guarantee you, had they had that option to save their lives
Right.
and to save the lives of their families, because even when the patient dies, the family is devastated. And to be able to remove that devastation with a vaccine is a no-brainer for most people. So it's really important that you look at that it's not just about you as a person, it's also what are you leaving your children, what are you leaving your wife, your husband, your mother, your father with? You know, those are long-standing decisions that you can't undo once they're done. We've had several patients that have asked just before you put them on the ventilator, well, can I go ahead and get the vaccine? I'll take it now. Well, that's not the way it works.
Right.
And it's sad. It's sad to be the one to tell them, I'm sorry, it's too late, you know. As far as our employees, we did really well in the initial portion of COVID, but with this surge, we're also seeing it affect our employees as well. We have a total of 148 employees who have tested positive cumulatively since all this started. Today, we have 6 that are actively sick. And I'm observing about 20 of the additional. So it's affecting them as well. And also, they're working so many hours and that they're just exhausted as well, and their immune system is down some. Our county numbers, we used to get statistics daily. Now we get them on a weekly basis. So the numbers for the week of July 30th through August 5th showed our county percent positivity rate at 20.4% positive. And then that with 40% being vaccinated, we had 468 new cases last week, but the positive note is we actually had 557 vaccines received. So for the first time, we had more vaccines than we had positive cases. So that's a positive move. As far as the state of Florida goes, for that week as well, July 30th through August 5th, our state percent positivity rate was at 18.9%. with 63% of the state vaccinated. We're just not that percentage of the state. So cumulatively, the state of Florida has lost 39,695 people to COVID. And just last week, we lost 175. I believe, if I'm not mistaken, our county death rate is at 174 right now. As far as hospital goes, our staffing, we have more critical patients than we have critical care nurses to take care of them. Their ratios are higher than we like for them to be. We are still safely able to care for the patients. It's just very taxing on the staff. But we always strive to give them the very best care that we can. As far as our county vaccination rate, in the state of Florida, there are only 13 counties who do worse than we do. We are number 14 from the bottom. At 40%, with I believe Holmes County has the worst percentage right now at 27%. The best county numbers are in Dade County. They're at 81% vaccination rate, and then they're followed with by Broward and Monroe County who both have 72%. So I mean, it ranges from 27% to 81%. And it's just, it seems to be the rural counties that are really struggling with this concept of vaccination. So, like Dr. Gay said, we really want to get this message out there. We're not trying to be demeaning. We're not trying to bully anybody, but we just want you to know what's happening in your county. It's not in China. It's not in India. It is, but it's in our county. Right. It's your neighbors. It's your church members. It's your golf buddies. It's it's your basketball team member, your baseball team member, and it's something that needs to be taken very seriously. And the vaccines are available at no cost.
Well, you can get a COVID vaccine free, and they're available at the Jackson County Health Department, the CVS and Walmart and Winn-Dixie pharmacies. The best vaccine you can get, people ask me which is the best vaccine. The best vaccine for you is the vaccine you can get. And so there are widespread availability for vaccines. There's a University of Florida website you can go to, coronavirus.uf.org/vaccination. And there's a Jackson County Health Department contact 850-526-2412, and then the state of Florida has a hotline, the COVID-19 hotline at 866-779-6121.
I would not call it urgent. I would call it emergent. It's emergent that this happens. It must happen. Mm-hmm. I'll let Dr. Gay speak to the effects of the vaccine and the length of time that it takes to develop antibodies, but this is an emergent situation.
Because it's bad right now and it's getting worse.
Yes.
Right.
The vaccines will begin to work almost immediately. If you get a vaccine today, probably within a couple of 3 weeks of let's say you get the Moderna vaccine, a dual shot. Within a few weeks of the first vaccine, you've developed 40, maybe 50% immunity. Within a week or two after the second vaccine, you're up around 90%. So there is some advantage early on. It's not complete immunity, but it is some protection against the virus, and it begins immediately. Low numbers in the beginning, but the longer you go without getting infected, the better immunity percentages you're going to have. The vaccines don't keep you from getting COVID. The vaccines keep you from getting critically ill and being hospitalized with COVID.
Right.
I was vaccinated in February with Moderna. A month ago, I was exposed to COVID-19. 3 or 4 days after the exposure, I get a cough, a headache. I doubt very much I've got COVID, but I get tested, and it's positive. There's an outpatient therapy, and I talked about this earlier, a dual monoclonal antibody that you can get as an outpatient infusion. If you're sick with COVID, whether you've been vaccinated or whether you've not been vaccinated, and you don't require hospital stay, you can be helped with an outpatient infusion, and you should talk to your primary care providers about the availability of that. Jackson Hospital gives that, gave over 125 doses last week. It's available at other hospitals around the community, and so I would urge you to talk to your providers about that availability.
One of the things that we're seeing with the hospitalized patients is they wait and they wait and they wait till they just about can't wait any longer, and then they come to the hospital. And it makes such a difference if you go and see your doctor when you're sick, when you start feeling bad, and if you test positive and you meet the criteria and have the symptoms that you require this infusion, you go ahead and get it. You know, it has to be given within the first 10 days of illness, onset of symptoms. But those sicker patients that we have in the hospital are those who have stayed home for 7, 8, 9 days and then came in to get help. It's important that you talk to your doctor, that you discuss concerns about your health, about your concerns about this vaccine, and listen to what they have to say. You trust them with other aspects of your life and your health. This is not an area that you can mistrust.
Right.
It's very important, and there's not a one of them that's going to lead you down the wrong road.
Okay.
If you're going to get a vaccine, and it's going to take 3 to 6 weeks for it to start protecting you, there are things you should do. This wave, this surge, is hopefully the last surge, and it'll peak in the next 3 to 6 weeks. Well, you can protect yourself significantly over that time, allowing the vaccine to take effect. And it's the same things we've been recommending all along. You social distance, you wear a mask in public. If you go into a situation or a room or a business and you don't know whether the people in the room are vaccinated or not, you should protect yourself. You should stay 6 feet away from people. You shouldn't spend more than 15 minutes in that situation. You should wash your hands frequently. You should do all the things we've been talking about for 18 months. Avoid large groups, which we're not doing. We're just tired of staying at home and staying isolated. But if you can do that for the next 3 to 6 weeks while the vaccine takes effect, then you may make it through this surge. And so don't give up on those measures that really make a difference while your vaccine is starting to work for you.
Right. Okay. I want to close with something that, Dr. Gay, you had it in the letter that you wrote to the editor. And Kay, tell us again how many Floridians have died from this virus?
There have been 39,695 deaths.
Okay.
As of August the 5th.
Okay, and that's just in Florida.
Just in Florida.
Right. And Dr. Gray, I want you to reiterate what you said in your letter about what we can do to honor these people that we've lost to this virus.
You can get a vaccine. I mean, that's the one thing you can do. You can bet, as Kay said, if those people were here and could look back, they would get the vaccine. The suffering that they went through before they died is horrendous. And I saw a patient yesterday, 50-year-old fellow with no medical problems. He said, I have never been this sick in my life. And he wasn't even sick enough to go in the hospital. And so, do you want to go through that misery? I mean, you know, forget about hospitalization and dying. Do you want to get sick for 2 weeks and expose your family and neighbors and friends to this virus? Is that what you want, or do you want to honor the people that have passed who, if they were in your shoes, would certainly choose vaccination.
Okay. All right. Well, Kay and Dr. Gay, thank y'all very much for talking to us today, and hopefully people will watch this and consider getting the vaccine, and thank you for all that y'all are doing on the front lines in this pandemic.
Thank you
Thanks for having us.